Hi, I'm Jessie Jong and I'm from New York in the United States. I'm excited to share my research which explores the natural compound luteolin, which is found in fruits, vegetables, herbal medicine, but now is also found in a broad scope of supplements and nutraceuticals. And I discovered that can be a double-edged sword and that natural can still be very powerful. So, supplements and nutraceuticals claim to have a range of benefits from being therapeutic towards cancer to being muscle strengthening to being memory strengthening to being antioxidant and anti inflammatory. However, the problem is that supplements and nutraceuticals consumption and trust is at a record high worldwide. Yet people trust the pharmaceutical industry significantly less, yet the same companies like Pfizer dominate both industries. So it's really difficult to tell the validity of these claims because of the lack of regulation. For example, in the European Union, where supplement regulation is the strictest, still do not require authorization pre-marketing. In the United States, the FDA does not check potency, purity, nor biological activity of the ingredients, and it's completely voluntary for companies to report adverse reactions to their products. This results in misinformation, as 75% of people in the United States believe that megadosing can produce greater health benefits than taking the daily recommended. Inconsistency, as that the daily recommended value can be undetermined, like for luteolin, and public health and safety consequences, as there are calls to the poison control centers every 24 minutes due to these supplements. So the flavonoid is a natural compound found in fruits, vegetables, and traditional herbal medicine, but now is also found in many supplements and nutraceuticals, as mentioned before. Luteolin is the primary ingredient in a wide range of supplements with varying purposes, and many of these supplements and nutraceuticals claim to prevent or in some way work against cancer. And though research has supported the idea that luteolin has some therapeutic mechanisms against myeloid leukemia cells and decreased cancer cell viability with increased concentrations, there's still very limited studies on this chemical, especially its interactions with the organisms that they are actually being consumed in. So this project aims to explore the effects of luteolin on neuroblastoma and lymphoma in order to find the mechanisms of the interactions to reveal more information about supplements and nutraceuticals and whether they actually live up to their therapeutic effects that they claim to have. So the first step of my method was to create dilutions. Initially, I created 3 dilutions of zero point 0.1 micromolar, 1 micromolar, and 10 micromolar. However, due to some unexpected results, higher concentrations were then created at a later phase. I did the dilutions using luteolin powder, DMSO, and minimum essential medium. To organize my cell plate, I generally use 6 by 6 well plates, and each treatment would get at least 6 wells, and each assay had 3 trials. So the graph values are an average of 3 trials or greater than or equal to 18 wells. So for my method, I used 6 different types of cellular assays. The first is the MTT assay, which was prepared with collagen, then incubated for 24 hours, and was taken in through HEMA3 stain and 400 microliters of hemofixation. Then for the attachment assay, which measured adhesion, I incubated it at 37 degrees Celsius for 24 hours, and I placed the MTT buffer as well as DMSO, and then I calculated cell viability through a spectrophotometer. I did 4 types of caspase assays, which will be clarified in the results. And 24 hours later, the contents of the well were placed in 1.5 milliliter tubes and then centrifuged for 3 minutes so that I could add the lysomic and lysis buffer. Then I used BioMevia microplate reader set to 405 nanometers. The next step was the withdrawal and activity trial, which was measured in mitochondrial sections and cytofractions. I washed the cells and I homogenized and centrifuged the cells. I used the directions on the complex 1 enzyme activity microplate kit, and complex 1 rates were calculated by dividing complex 1 activity by time. For readhesion, the concept is still the same as the attachment assay. However, I just tested its ability to induce reattachment from the same cells rather than efficacy. As for organoid modeling and trials, I suspended it in ECM medium, incubated at 37 degrees, and used CVYA culture medium. I used a patient-derived organoid model from cells of tumors and nerves, which are known as IMR32 cells, and diseased human large B-cell lymphoma. I didn't just want to test the results biologically, I also wanted to predict mechanisms. So prior to molecular modeling, I used biochem data and I used simplified molecular input line entry system to prepare the ligand. Then I downloaded Ludolin from PubChem and used the online SMILES translator in order to convert the spatial data file, SDF, to a program database or PDB file. Then I prepared macromolecules using the RCSB protein data bank and utilized Pyrex Autodoc Vina created by the National Biomedical Computational Resource, or NBCR. I inserted the ligand and I used Vina Wizard in order to calculate the binding affinity. Then I used Discovery Studio Visualizer BioVia version 20 to render an interaction in a clear 3D format. I set the grid box dimensions in PyRX of the X, Y, and Z conformations fixed at 25, 25, and 25. For cancer cell survival phase A and phase B, I chose to do phase B after some surprising results of the phase A adhesion assays. So for phase A, it's basically both the neuroblastoma and lymphoma cells parallel each other in that the highest concentration of luteolin induced the greatest cancer cell death. So in regards to cancer cell death, luteolin to a certain extent does act in a dose-dependent manner, but after 10 micromolar, there was no decrease in cell death, so it's relatively stable. So this indicates that taking more supplements or a greater concentration of a natural compound is not necessarily more beneficial because natural is not neutral. And another important aspect that I found was that though the greatest cell death was induced on neuroblastoma cells, it's a 5.1% difference. So luteolin may be more effective on certain cancers. For some more information on the technicalities of my results, error bars for all results represent a 95% confidence interval. And the key on table 2 is the representations of statistical significance for the results, for all the results shown. For phase A of adhesion, I decided to do adhesion because I hypothesized through my literature that a decrease in adhesion would decrease cancer cell progression, as this tries to stimulate what would happen with cancer cells on real organs. The first thing that I noticed was that varied concentrations are more influential with a carcinogenic or pro-cancer agent, in this case TPA. The turquoise bars in both figures indicate that though luteolin decreased adhesion, the differences in concentration were insignificant, whereas pink bars on both figures indicate that when a concentration played a large role if added to a pro-cancer agent. Another interesting factor that I found was that different aspects of cancer should be quantified separately, as luteolin induced greater cell death on neuroblastoma cells, yet induced greater cell detachment on lymphoma cells. So patterns seen in one cellular assay may not parallel another cellular assay. Furthermore, greater concentrations are not equal to better because figure 12 seems to show that the middle concentration induced more detachment from the highest concentration, which is quantified by figure 13, which indicates that after the 35.1% detachment caused by the middle concentration, there was a jump in adhesion. Figure 13 displays that 0.1 micromolar and 10 micromolar had relatively the same effectiveness in inducing detachment, so there definitely is an optimal range. So this concept of an optimal range prompted me to explore other concentrations of luteolin to see if the jump in adhesion is consistent, which is now known as phase B of the adhesion experiments. For phase B of the adhesion experiments, I found that lymphoma cells are more difficult to detach for luteolin, and that there's no strict pattern for luteolin with lower or higher amounts being better. Rather, there's an optimal range. Saying that less luteolin is better is not true, but saying that more luteolin is better is not true either. There's simply an optimal range for certain cancers, at least for lymphoma and neuroblastoma. Luteolin at high concentrations may actually aid adhesion rather than hurt, and this pattern is exhibited in that the optimal range, each successive concentration decreases detachment less. So if this pattern continues, luteolin will either not detach any cells or cells will proliferate and attach. Furthermore, I found that luteolin can actually induce cancer cell readhesion with varied levels of significance, but in all treatments, when 10 milligrams of luteolin were added, which would theoretically be way over the optimal range as for my results, according to figure 16 and 17, it caused cells to reattach to the cell plate, which basically says that it can help induce cancer. So it can prevent cancer, but it can also induce readhesion in cancer, which is highly significant. So I didn't just want to test biologically, the results. I wanted to predict potential mechanisms. So I predicted mitochondrial complex 1. And I conclude that the behavior that luteolin exhibits can be attributed to mitochondrial complex 1 with two strong pieces of evidence. First, the extremely low kilocalorie per mole value, which means it's highly affinitive. It had a binding affinity of -10, which is extremely rare for any molecule. Any binding affinity less than -5 is considered to be highly affinitive. And I docked 22, and mitochondrial complex 1 was the most affinitive. Furthermore, figure 19 depicts the highest complex 1 activity for both cancers. So it means that cell death was greatest during the same period where mitochondrial complex 1 activity was the greatest. And this is not true for caspase activity that I tested. A lot of scientists believe that flavonoids go through caspase activity, but I believe that luteolin is unique in that it does not go through caspase activity because when luteolin induced the greatest cell death, caspase activity was actually the lowest. So it actually may inhibit caspase activity. Furthermore, some supplement companies encourage people to take a variety of supplements together, but I found that with resveratrol and luteolin, the combination is more stable as luteolin alone creates more distinct jumps, but a combination is not necessarily more effective as luteolin alone causes the lowest amount of cancer cells. So what should we take away? In the future, I would like to do this on an animal model, but for now, we realize that luteolin may not go through the commonly hypothesized caspase-dependent pathways, and that luteolin is a double-edged sword. So with this knowledge, and how 85% of supplement labels don't contain the maximum dosage, and only 17% of people read labels consistently, natural cancer remedies still should be used cautiously, even if they're natural. And awareness and caution should be taken when using luteolin supplements, and we all should advocate for reform and greater transparency from the supplement industry, because natural is powerful, and natural is definitely not neutral. Thank you so much for listening to my research, and here are the references on the right. And I really enjoyed presenting my research to you today.